Chairman, ladies and gentlemen, good afternoon. First of all, I would like to thank the organizing committee for giving me this unique opportunity to present our work. Here you can see our disclosure, and I would like to say that this work was not sponsored by the industry. It has been shown that even without obvious bladder outlet obstruction, majority of women after sling procedure are transiently suffering from undesired LATs, and voiding and storage dysfunction are generally underreported, especially in the very few weeks after the operation, and probably due to the fact that a happy-to-be-dry patient may not be compelled to report minor, in their opinion, voiding dysfunction. So the aim of our study was to assess the efficacy of Solifenacin or Mirabegron as a prophylaxis of undesired LATs in women after just transobturator mid-urethral slings. I would like to say also that many women, even with urodynamic confirmed incontinence, often present with other lower urinary tract symptoms, including urgency, frequency, and nocturia. And we have shown in a recently published study that these symptoms are especially exaggerated during the first 2 weeks after the operation. The study group consisted of 345 patients who had underwent an ambulatory transobturator mid-urethral procedure, and all patients was detailedly questioned before and after surgery for the occurrence of common LATs, and we divided our patients into 3 groups without any additional treatment after the operation, prophylaxis with Solifenacin or prophylaxis with Mirabegron, and here you see the flow chart of the study. As you can see, the evolution of the storage symptoms after mid-urethral sling was different in control group and the group treated with Mirabegron and Solifenacin. And as you can see, the evolution of urgency was much faster when the patient was treated with both type of drugs, and also this was true when the frequency was taken into account. The other symptoms was not influenced by this treatment. However, in majority of patients, in more than 95% of the patients, the symptoms resolve within the first 2 months after the procedure. So the concluding message is that shorter treatment with Solifenacin or Mirabegron could significantly decrease the percentage of undesired LATs, namely urgency and frequency, after transobturator mid-urethral sling, and therefore at that point improve patients' quality of life during the first weeks after procedure. Thank you very much for the attention.
Do we have any questions from the floor? I have a question about what do you think the performance, say, of a placebo group might have been in this setting?
In fact, it was not a placebo. The patients were, we considered the placebo the patients who did not receive any kind of prophylaxis.
But the other patients thought they were getting something. Thought they were getting something to help maybe urgency?
But you know, as you know, it was not industry sponsored, so
right,
to have, you know, even if we gave to them vitamin D, right, probably it would influence, or vitamin C.
Well, so, that helps everything.
So
we learned that.
It should be sugar, maybe, but I would like to stress that all these patients has really symptoms of stress urinary incontinence, which was confirmed by cough test, and all patients has any significant abnormalities in the POP-Q score. So the POP-Q was 0 or 1. So that's how we choose the patient.
Please.
Johnny Shaw, Dartmouth Hitchcock in New Hampshire. Any difference between placebo and the medication groups in retention, post-op retention?
No. No, the patient did not experience all procedures were performed on the ambulatory basis, and the patient were discharged after successful voiding attempt. So that means, that patient void within the first 4 to 6 hours after the procedure, and of course the post-void residual should not exceed 50 mils, provided that patients voided 200 mils of urine.
Bernie Halen again. Were there any subtle signs of voiding dysfunction? For instance, if you're instituting this treatment a week or two later, what was the residual a week or two later? Did you measure that before you started treatment as a possible indicator that it is some form of mild obstruction that's causing the urgency?
Also, before patients was discharged home, we checked the position of the sling and the distance of the sling from the urethra ultrasonographically. So only patients with no significant residual or clinically significant residual were discharged home. So that, in fact, we are using a small modification of this transobturator sling procedure. It was described in Urology Journal in 2015. And it is called tape fixation. So we know that the tape is properly located at the middle part of the urethra.
Did you control for urinary infections post-operatively?
Yes, we did, and in fact, the patient received prophylaxis with fluoroquinolone 3 times daily, 500 micrograms for 3 days, and the incidence of infection after was small than 2%.
Thank you. I think we're going to move on to the next one. But incidentally, since it wasn't sponsored by a drug company, it would be nice to see this with something that's generic for those of us who have a hard time getting patients based on their insurance for permission for Vesicare or Mirabegron.
Thank you.